I did forget to point out that with amantadine, there's a kind of a rare, unique side effect called libido reticularis, which is really the outcome of a cumulative dose side effect. You see it when patients are on this drug for 6 months or more, and sometimes abruptly stop the medication for a variety of reasons. It presents with a lacy, kind of purplish discoloration of the skin and the legs, and you see some leg swelling. It occurs in less than 1% of people with Parkinson's disease who take this medication, but because it's so unique and rare, they do like to ask about it on STEP. So I forgot to include that in the previous video. So the next component, let's look at direct-acting agonists. So direct-acting agonists basically stimulate dopamine receptors. These drugs act as direct agonists, and they don't really require metabolic conversion. They don't compete with amino acids for their transport across the gut or the brain. They don't depend on neuronal uptake and release like some of the other drugs that we've talked about. They also tend to have a much longer action compared to levodopa. All the drugs in this category have relatively greater selectivity to the D2 receptors versus the D1 receptors. And as you can see from this table, all the dopamine agonists also have affinity for D3 receptors, which are expressed in the mesolimbic pathway. Agonism of the D3 receptors can lead to compulsive behaviors, one of the side effects of dopamine agonist therapy. The other adverse effects caused by dopamine agonists are similar to those of levodopa, so nausea, vomiting, sleepiness, orthostatic hypotension, confusion, and hallucinations. Treatment with pergolide or cabergoline is associated with a significant risk of valve heart disease due to serotonin receptor activation on the heart valve. Pergolide itself was pulled off the market back in 2007. Dopamine agonists are commonly used in combination with carbidopa and levodopa to reduce the amount of off time patients experience. When these combinations work well, the dose of levodopa can be reduced. Domperidone is also a dopamine receptor, but this one's an antagonist, with selective peripheral activity in the upper GI tract. Since it does not cross the blood-brain barrier, it does not affect dopamine activity within the CNS, but it does help reduce the peripheral side effects associated with dopamine agonist therapy, such as constipation. It's not available in the US, but it is available in Canada and some other countries. However, if you do need to get it for some of your patients, there is special permission that's needed from the FDA to use this drug for stomach motility issues. Interestingly, there is a black market use for this drug, as some patients use it to stimulate or enhance production of breast milk. Finally, Parkinson's disease and some of the treatments that we've talked about can produce hallucinations and psychosis. And these are really problematic for a lot of these patients because these hallucinations and these psychoses really are the things that make dealing with these patients and their caregivers really stressed out. And so these are the things that typically wind these patients up in nursing homes. So it is a biological problem, but it's also a social problem as well. And so confusion, visual hallucinations, and psychosis, these are major dose-limiting factors for the long-term dopaminergic management of Parkinson's. For this reason, you can see the introduction of atypical antipsychotics being a major treatment advancement for the management of psychosis in these patients. For patients with troublesome hallucinations or delusions, despite anti-Parkinsonian medication adjustments, the options include quetiapine, pimavanserin, or clozapine. Low doses of the antipsychotic drug clozapine, anywhere from 30 to 50 milligrams per day, have been shown to be really helpful in reducing the dyskinesias. A side effect to clozapine is agranulocytosis, antibody production against neutrophils, basically, and this is going to require monitoring. Benztropine is an acetylcholine receptor antagonist which has been used to treat symptoms of Parkinson's disease or involuntary movements due to the side effects of certain psychiatric drugs. Benztropine may also increase the effect of dopamine by inhibiting its presynaptic reuptake. Adverse effects of anticholinergic drugs are common and often limit their use. Older patients and patients that have cognition impairment are particularly susceptible to memory impairment, confusion, and these hallucinations that can be exacerbated. So they really shouldn't receive these drugs. So we'll spend a lot more time on these antipsychotics in a couple of future cases, and you'll understand kind of the dynamics that exist between dopamine and acetylcholine and serotonin. Okay, so that concludes this lecture series, and please email me with any questions, and I hope you're enjoying the blog. Thank you.